Hello and welcome back to Doodles MD. I'm Falake Lawal, your host, public health, internal medicine and infectious diseases physician. This week we're going to be talking about heart valve disorders. Before we start, please subscribe to our channel and make sure you remember to share and like this video. Stay tuned. Valvular heart disease is when any of the valves in the heart is damaged or diseased or not working properly. Remember, we talked about in the normal functioning and structure of the heart, we talked about the walls, the chambers, the layers, and also the valves that serves as the door that regulate flow from chamber to chamber. So whenever any of these valves are not functioning properly, it's valvular heart disease, and there are several causes. All over the world, rheumatic heart disease seems to be the most common. We have about 41 million people globally with rheumatic heart disease, and like I mentioned earlier, it's a heart disease that autoimmune response. You get an infection in your throat, your body sees something about that infection, like it triggers a part of your body to look abnormal, and your body basically attacks itself, and literally that's what happens, and the valve gets damaged. Usually most people tend to have mitral valve disorders with that, and that tends to also be more common or most common in low and middle income countries. In developed countries or more advanced countries, you can find it in populations that either are of low socioeconomic status or have poor health coverage, poor health indices, and things like that. Another common cause is calcification, which tends to be more related with age and hyperlipidemia. So when it's inflamed and then calcium deposits, so the tissue is already damaged and dying, and then you have calcium depositing on it, and that is about 9 million people globally. And then degenerative mitral valve disease. Again, these last two are somewhat wear and tear related, but can be accelerated by other diseases. So the types of valve heart diseases that we have, very simply, it's either what they call incompetence that leads to regurgitation, or it's stenosis. So you have a door, right? And it's either, or a valve, a tap, let's call it a tap. It's either your tap is working normally, it opens when it's supposed to be open, it closes, and it seals shut, right? When it's difficult to open, like, it's tight and stiff, that's what we call stenosis. And that means that whatever is meant to flow through it is restricted, is reduced, and there's a lot of back pressure. Those are things you need to remember. So when it's not opening properly, opening a little bit, there is higher pressure trying to force things through it, and you have a lot of back pressure. Depending on which valve that is stenosed, the chamber preceding it, right, in flow, coming before it, now has to muscle up, basically, in trying to push, and then of course it can eventually fail and become flabby. So you can have mitral valve stenosis, you can have aortic valve stenosis, you can have pulmonary valve stenosis, you can have tricuspid valve stenosis, but the most common ones are mitral valve and aortic valve, but particularly aortic valve stenosis. So it means it's difficult pushing out of the heart into the body. The other type is regurgitation from incompetence. So it means it's not working properly. It's not closing when it should close. It's not closing and sealing shut. So it means that there is always backflow. So the blood goes up, right? And then it's supposed to shut so that everything just keeps flowing forward. But because it's high pressure and then the valve is not working properly, things come back, right? And flow back into the chamber that has ejected something. So whatever is left there, let's say you had like 30 mils left and 20 mils comes back, you now have 50, right? Now the blood that's coming from wherever it is that's supposed to drop 70 into there can only drop 50 because your chamber for instance, can only hold 100. So it means you're not getting enough blood out into the body and to function. So your heart tends to overwork, again, trying to work faster to be able to catch up with the demand, right? There's a demand, there's an amount that's supposed to go out, and it has to now beat faster because each time it pumps, it doesn't get enough to the destination. Again, this one, you can have aortic regurgitation, mitral valve regurgitation, tricuspid valve regurgitation, and all of them can have either a variation. And sometimes you can actually have a mixture where it's stenosed and then a part of it also becomes regurgitant, and that's a bit more complicated to handle. So what are the causes? One of the most common cause is age. Just normal wear and tear in elderly people that can be accelerated by systemic diseases like hypertension, diabetes, hyperlipidemia or hypercholesterolemia. These conditions can make the damage, the normal wear and tear faster and more pronounced. There's what we call congenital. Congenital just means you're born with it. It doesn't mean like you inherited it from your parents, but it just means that when you were born, it was there. And that's what congenital means. Congenital, it can now occur either from like an infection, things like congenital rubella. Rubella is an infection. It's a viral infection that's similar to measles. So when you think about the MMR vaccine, it's measles, mumps, and rubella. And rubella is a viral infection, and when people are not vaccinated, especially pregnant mothers are not vaccinated against it, the child may be exposed. So the child can catch that infection in utero, and it can cause problems that include valve disease. Other connective tissue diseases that people are born with, like osteogenesis imperfecta, it's a collagen disorder, and it's collagen that forms the valves and other parts of the body. So they have abnormalities of that. Things like Marfan syndrome also. Look that up. I'll put the spelling. I don't want to bore you with that. Autoimmune diseases also can cause valvular heart diseases, and under this, mostly these tend to be acquired. This is things that now happen to you after you were born, and it's usually maybe from an infection like rheumatic heart disease that happens after a bacterial infection, a bacterial throat infection. Syphilis, tertiary syphilis, which is like third stage. There's primary, there's secondary, there's tertiary. Tertiary syphilis can cause valve heart disease, and it can cause, neurological problems too. Dilation of the heart from whatever cause. So either, you have dilated cardiomyopathy or dilation of the heart from too much fluid or things. As long as it's expanding and it's pulling apart that place, it damages, the dimension of the valves. Myocardial infarction, which means like dead cardiac tissue, and if that affects that area also, then you can have valvular heart disease resulting from that. Surprise, surprise, or no surprises, pregnancy. And for a number of reasons, which when we talk about like just the physiological changes in pregnancy at some point, we can touch on how, it affects, because the blood volume increases, the heart is working extra, there's a lot of hormonal changes. These can also cause someone to develop a valve heart disease. The symptoms or clinical features that you can get are similar to what you have with heart failure. In mild to moderate valve disease, many people may not have symptoms, and sometimes these are things that we pick up when we listen, right? We listen and it's basically a clinical sign. But when things are advancing, then you start seeing symptoms like chest pain, palpitations. People can get tired just because they're not getting enough blood circulating and enough nutrient supply to all of their body. Dizziness can also ensue because if you're not getting enough blood out, it's not getting enough blood to your brain, you're not functioning well. Low blood pressures also can occur depending on which valves. shortness of breath, and this happens when you have backflow, usually into the lungs. When the heart failure, of course, advances, the backflow can really back up into the IVC, which is the large great vein, and that connects almost directly to the liver. So the liver can feel that back pressure, and people can have pain just because it's stretching, right? It's stretching, and then that further flows down, and you can have like swelling of the legs, abdominal swelling and things like that, which means things are really leading into heart failure. So on the right side also, when you have disorders of the right that causes pressure to increase the flow into the lungs can also increase pressure, and a big complication is pulmonary hypertension. When someone is going into pulmonary hypertension, sheesh, that's really bad, because now even if they're going to get heart therapy, the lungs are a whole nother thing that really needs to now be fixed. So pulmonary hypertension is one of the big complications of heart disease and valvular heart disease, including of that. Other complications can be strokes, can result from that. You can have other failures like liver failure, kidney failure, again, because you're not getting enough into other parts of the body. Next is management. Now, in treating all of this, first of all, you have to even try and figure out what's wrong. So either you're having symptoms or they picked it up incidentally. The first step usually is, again, to do an electrocardiogram, ECG or EKG, to see the tracing. That gives us some information. We do imaging of the heart, either through an echo, through the surface on your chest, it's kind of like an ultrasound, or through the throat. They put, a scope down there, and it's closer to the heart, and they're able to see much closer into there to see the valves properly. Another is cardiac MRI, that gives a picture when it's moving, or the regurgitation, you can see all the nice pictures. One other thing, this one is a bit invasive, is called cardiac catheterization. And in cardiac cath, what is happening is a cath is basically passing a cath, but the catheter is going through your blood vessels into the heart, and this is using a dye to color the heart in a funny way, to color the heart so that when we take pictures from the outside, it gives us an outline. It's almost like a silhouette, right? Someone is standing behind a light, and you can see the shape and form, and that's what cardiac cath does. It also helps because there's something directly inside the heart, literally inside your heart. It's able to measure pressures, okay? It's able to measure pressure in each chamber directly. And that is awesome because it helps to predict a lot of things and also helps to determine therapy. Sometimes in cardiac cath, they can use it to test certain medications, and if somebody reacts well to that medication, they can be like, okay, we can treat with this, and if they don't react to that, they'll be like, okay, we treat with something else. So cardiac cath is one of the very important tests or investigations that needs to happen in diagnosing and management of valve heart disease and heart failure. Now, actual therapy, medications, of course, depending, do you want to relax the heart? Do you want to slow it down? All of those medicines happen to be part of what we give. We talked about beta blockers, calcium channel blockers. Next is surgery. Valve replacement surgery or valve repair surgery can happen, and many times most people are used to open heart surgery. Crack your ribs open, they open the heart, they do that. Technology has really advanced, and there's some other therapies depending on the type of heart. So for people who have things like stenosis, which is like stiffening, they can do a balloon valvuloplasty. So again, through something what looks like a cardiac cath, they pass a little nick through the groin. There's the big artery, the femoral artery through the groin. It goes up right into there, and it goes into the heart, and then when they get to that vessel, they inflate the balloon, and that poof forces that valve open, usually in calcified stenosis and things like that. Another is what we call short form TAVR, which is again transaortic. It's similar to the cardiac cath procedure, but this time it is actually a valve replacement. So you can have a somewhat minimally invasive, we'll call it. So it's not an open heart, but it is a proper valve replacement. So you can have valve repair and valve replacement. Both of them can either be open chest or through a small hole and through the cardiac cath way. So that is where we will stop, or I will stop this week on valve heart diseases. Let me know what questions you have. If you have experiences or questions, let us know. And if there's any part that needs a little more clarification, we can always do that. Please remember to follow us on the rest of our social media channels. Like and subscribe. Like this video, subscribe to our channel, and share the video. Till next time, I'm Folake Lawal. Next week, we're going to be talking about ischemic heart diseases, which is ischemia, low oxygen and dead tissue. Till next time, I'm Folake Lawal, signing out on Doodles Empty.